So good morning to all of you. I am Dr. Anurag Awasthi. I am one of the orthopedic consultants at CK Birla Hospital for Women in Gurgaon. Here we are dealing with quite a varied spectrum of orthopedic problems, including sports injuries, including bone and health issues, joint problems, and we are also doing high-end surgeries like complicated fracture fixations, joint replacements, and arthroscopies. So today we'll take some questions about a common problem called avascular necrosis. It affects the young people at most of the times, and we'll just discuss and let you know a little more about it.
What is AVN and why is it important for us to know about it?
AVN basically means avascular necrosis. This implies in common terms that a part of the bone is not getting its adequate blood supply. This may lead to necrosis or death of cells, which eventually leads to damage of that particular part of the bone or a joint. Now, AVN is very common in the hip joint, particularly the ball of the hip joint, which we call as a femoral head. And there are many reasons why it can happen.
What are the common reasons that may lead to AVN?
Okay. See, AVN, lot of cases we don't really are able to pinpoint to a particular reason, but among those where we are able to pinpoint, the commonest would be steroid intake, whether it is in the form of tablets going on for weeks or months, or in the form of injections which are high dose or which continue for a long time. So steroid therapy for any patient, whether it is suffering from chronic skin diseases, whether there are some immune related problems which require long-term steroid therapy, post-organ transplantation patients which require steroid therapy, all these are much more prone to develop AVN. Among the second reasons would be any person who is exposed to high intake of alcohol over the years, yes, can develop changes of AVN. Third common reason we find that patients who have had injuries in the past, say a young patient having a hip fracture, can eventually develop AVN changes, say 2-3 years down the line, because of the trauma which was sustained at the time of initial accident.
We often hear stories on side effects of steroids. What is the implication in this context?
Steroids are very useful under certain medical emergencies, but unscrupulous use of steroid can lead to damage to the bones, what we commonly call as avascular necrosis. Now, just to quote, we had a patient who was a lady, 32-year-old from Uzbekistan. For some reason, she had undergone a liver transplantation, say 3 years back, say prior to the age of 29 years. When she came to us, she had been suffering with hip pain for around a year, and she was finding it pretty difficult to even stand and walk. Now, we know that post-organ transplantation, to prevent a rejection, we often use steroid therapy, which continues for weeks or sometimes months. This influences the blood flow which is going to the femoral head. With time, there are metabolic changes which eventually lead to less blood flowing to the femoral head. Now, in that particular instance, the lady developed changes within 2 years of the transplant happening. Now, steroid therapy is very useful and under special indications are used by the clinicians worldwide. But we should definitely avoid unscrupulous use. We should not use steroid in each and every patient, and in some cases where we need to use, we must always inform the patients prior that in this case we will be using this therapy for a short duration for this and this advantage.
How do we diagnose AVN?
AVN early changes can be diagnosed on MRI. If there is a hip pain which is going on for 3 to 4 weeks and not responding to standard physiotherapy or normal analgesics, we often ask patients to undergo an MRI. Now, MRI is an investigation which can pick up even the earliest changes of AVN within few weeks or few months of the startup process. AVN can even be picked on MRI even before the X-ray changes are apparent. So if a patient is showing normal X-ray but you have a high degree of suspicion for AVN, yes, we should go with MRI.
Do all cases of AVN need surgery?
AVN, as per an estimate, approximately 60 to 70% of patients can be treated without surgery, provided we have a diagnosis right in time. Now we classify AVN into different grades, starting from grade 1 to grade 4. Now in the first two grades, say grade 1 and grade 2, we always try to offload that hip joint so the pressure is less. Second, we put them on medical therapy, which is called as a bisphosphonate therapy. There has been studies which show that AVN changes can be reversed if we continue bisphosphonate therapy for a year or more than that. But beyond a level, when it crosses level of grade 2 or more than that, at times we need to combine bisphosphonate therapy along with a limited surgical procedure which we call as a core decompression. Now in the core decompression, we make multiple small drill holes in the hip joint in the ball area to allow revascularization. So revascularization basically means we create microfractures to allow the body to make more inroads in that area, form new blood vessels and improve the blood flow. So at times we ask patients to be taking only a bisphosphonate therapy, that is a medical therapy with offloading of the joint. At times we tell them that okay, core decompression along with bisphosphonate is the right way to go, plus we give bone marrow injections there to optimize healing. But if the patient crosses grade 3 and is showing signs of osteoarthritis in the hip joint with involvement of femoral head as well as the acetabulum, we may need to go for a total hip replacement.
How can we save our hip joints from possible damage by AVN?
See, high index of suspicion, do not ignore any hip pain which is going on for more than 3 weeks. Stay away from alcohol. Please always ask your doctor if the treatment contains any form of steroid. Keep a tab of all those things. And in case you have a hip pain which is going on for 3 to 4 weeks and not settling down, please immediately meet with an orthopedic. They may ask for an MRI. Please go ahead with that investigation so we can pick up those early cases which can be managed medically.